It is the magical video that we have all been waiting for, and it is discharge during pregnancy. Once, baby is headed well into the third trimester, stuff's just going to be going on down here, and you'll wish that you had a Kleenex down there, but that's not what it's going to be. Today, we're going to talk about the different types of discharge that you might have and what that discharge tells you. Is it a crystal ball about upcoming labor? Today, we're going to talk about it so you guys aren't confused about this very fun part of pregnancy. And it is something that I've seen in my 25 years in labor and delivery. People were often coming in talking about changes in discharge, different colors, different textures. I want you to know you shouldn't be worried to talk to your labor and delivery nurse about all of these different things. We're happy to talk about it. And there can be things that we notice from different things about it. So let's jump into this fun topic. First one is the mucus plug. Now, at the end of pregnancy, your body is going to collect a bunch of cells and, in fact, mucus at the end of your uterus, kind of like as a cork, to help keep baby safe inside the womb. Now, as you progress into pregnancy and the cervix starts to soften, as you can imagine, that cork sometimes falls out because nothing's holding it in. Think of it as a bottle of wine that's upside down. If the top of the bottle of wine started to soften and open up, that cork would fall out because of our friend gravity. So the mucus plug tends to be thicker and chunkier, and usually people notice it when they wipe, or they might notice it in the toilet after they pee. In general, it doesn't come out right in your underwear just because it is so thick and chunky. I said this video would be super fun, and that's where we're at. So the mucus plug. Now, is it a sign that you are in labor? Absolutely not. It is a sign that something is happening. Your cervix is likely opening. If you're early on in pregnancy, before when baby should come out, it's definitely something that you should mention to your provider. But, if you're past 37 weeks of pregnancy, it probably shows baby's coming out in the next week or two. Often it is a sign that labor is going to be soon. Time to pack that hospital bag, but it isn't a sign that you should head right into the hospital. It's just, the pre-show. And what a very fun pre-show as well, right? I actually gagged when I saw mine. Side note, I only noticed my mucus plug on one of my 3 pregnancies. I actually have a whole video about the mucus plug. I know, you're so excited. I'm going to link it down below in case you want more information on that one. Editor Hillary here. I did want to say that if you're already in labor and the mucus plug comes out, then, that's part of the signs of labor. But the mucus plug alone isn't like a sign of labor. It is a sign that something is happening. I just wanted to clarify that. Hope you're enjoying this magical video. The next one is bloody show. Now, blood can come from a variety of areas in the birth canal. It can come from your womb or your cervix, which is a little bit more problematic, but it can also come from the birth canal. And that can happen when you have things like sex or an exam. Those tissues just have extra blood flow in them. So anytime they're bothered, they bleed a little bit more than usual. And so that type of bleeding can be normal. Also, bloody show can be a variety of different colors. Brown blood shows that it's older blood. It's blood that's collected. Sometimes you'll see that with a mucus plug. You'll see some of the brown with the mucus plug, and those are red blood cells that have just collected along with the mucus. Blood can also be bright red, and that shows that is active bleeding. Now, you have been afraid of bleeding your entire pregnancy, as well you should be. It's not really something that we want to see during pregnancy, and it would normally trigger a call to your provider. However, once you get into labor and you start contracting, or if you've had a recent exam, or you've recently had sex, a little bit of bleeding can be normal. Now, bloody show can also be very normal as you get closer to delivery, but it should not be a large amount of blood, especially when you're hanging out at home. If you're at home and you see more than a quarter, I'm talking about like the monetary value, not like a quarter of the pad, just like a quarter on your pad, that's something that would trigger a call for me to my provider. Again, if you're past 37 weeks of pregnancy. If you're prior to 37 weeks of pregnancy, it should also trigger a call, but is a little bit more nervous. But if you have any questions about bleeding, please do call your provider. Most of them have someone on 24/7, especially the end part of your pregnancy, so that you can get in touch with somebody in case you have questions like this, because bleeding can be problematic, but it can also be a sign of labor. If you're in labor, it's a little bit less worrisome. Again, we want to keep it to about the size of a US quarter, meaning, about that. Like the A-OK sign. Although I think my kids said this was bad, so I should probably stop. Now, finally, just your basic everyday discharge. Now, some of this can actually be the mucus plug that's sort of melting. You might notice a little bit of chunky, but also different. Oh, this video is very fun. I'm here for you. Now, this is generally because there's just more blood flow to that area. You have more pressure with the baby bearing down on those tissues of the birth canal. It can be more watery. It can be different colors. Now, if your discharge starts to burn or is extra itchy, that's something that you definitely want to bring up to your provider. Could be that you have an infection that they can help you clear up. And those infections can actually cause preterm labor or contractions that are completely useless. So you definitely want to stop those. I know I had a yeast infection later on in one of my pregnancies, and doing a round of monostat really helped me feel a whole lot more comfortable. Now, like I said, this can be real thin, and it's very easy to wonder, did my water break or is this just discharge? I actually have a whole video on is it a small leak or did my water break? And I'm going to link that one down below in case you've had those questions as well. And I would say that most people are wearing a pad in their last few weeks of pregnancy because of these changes in discharge. The good news is if you think your water has broken and you're not sure, your provider or the hospital can let you know if it is actually your water that's broken or if it's something else. We have tests that we can do that. So that's a good reassuring thing. Most providers, I think, have something that can kind of tell you in the office. And let me give you a pro tip. If you can be seen in the office, it is so much faster and easier than coming into labor and delivery. So if that's an option, I would definitely go with your provider versus coming into the hospital. Although the hospital is open 24/7, so we are always there and you are more than welcome to come and see us. Now, as you've had all these changes in discharge, you might have thought, what happens if my water breaks and I'm like at work or in my car? What do I do? I actually have a whole video on what to do if your water breaks in public. I'm going to link it up above and down below. Thanks so much for joining us here on this very fun video at the Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.